First, let me thank all of you for coming here. So the reason why we are here today is that yesterday, we performed Goa's first total ankle replacement surgery at Healthway Hospitals, and this was done on 2 patients back to back, and both these patients were suffering from ankle arthritis. Usually, the ankle joint is one of those joints which does get damaged in a simple ankle sprain, or it could be a very violent fracture, or it could be some sort of a sports injury. But if these injuries eventually cause a lot of damage to the cartilage, total ankle replacement will last more than 20 years. It started in 1996, so now we are in 24, and he has done more than 2,000 cases. So he is like the one who's invented the whole concept. And he also has designed, along with his wife, who is also an orthopedic surgeon, Dr. Roxa, who is also an accomplished orthopedic surgeon. They have designed H2 ankle prosthesis, which is US FDA approved, and an H3 one, which is the one we have used. So we are in Goa today, we are at the cutting edge of technology. And we were fortunate enough that Dr. Pete Tinterman and his wife, they came down here to perform the surgery. And after doing the surgery, I think he will explain what was his experience and what it means for India as far as healthcare is concerned. I also have with me Dr. Dhrumin Sangloy, who is a orthopedic surgeon from Mumbai, and he's from the Nanavati Hospital, and he's part of the team of the surgery here. And so all 4 of us were part of the surgical team who performed the surgery yesterday on the 2 patients. The patients are doing very well and should be discharged in another day or 2. So if you have any specific questions, you can ask Professor or any one of us, and we will be glad to answer them. You want to ask anything, Professor?
Let him share his experience about yesterday's operation.
Okay, so they want you to speak a little bit about what was your experience in Goa about research? How
Yesterday?
Yes.
Okay. First of all, an ankle osteoarthritis is not a simple problem of the joint itself, but also around the soft tissues and the joints around, and very often ends up in a complex problem with deformity and instability. So both cases were very complex cases where the ankle prosthesis was just a part of the surgery. That means the worn out cartilage, that means arthritis of the joint, was treated by implants, but to get it work, to get the foot stable and balanced, it needed to be aligned and stabilized. What has been said is that an ankle arthritis has a major impact on the health status of a patient, of social life, of life, professional life, of everything. And we know that from several studies that the impact of such an arthritis is higher than, for instance, for a hip or a knee. That means a patient who has this kind of problems is more exposed to problems than with a hip or a knee, because it can compensate. It cannot walk on the arms or upwards. You need to walk on the foot, and that makes it so important to have these solutions.
Any other surgery before he has done this ankle?
So Professor had come last year, 2 years back to Mumbai, and has performed 7 total ankle replacements.
No. For this patient.
Yeah, so patient had a surgery way back in 2008. Primary injury was in 2008 when he had an ankle fracture. And when the ankle fracture healed, it healed in a little bit of a wrong position, and that predisposed to the arthritis. Plus, the injury itself could have damaged a lot of cartilage. So we can't say that the surgery did it, but sometimes the injury is so violent that it can damage the cartilage. So some patients with ankle injuries will end up with arthritis. So this was one of the patients, and he's a very active patient otherwise, and he was seeking pain relief. What he was seeking was just pure pain relief from that problem. So ankle, as Professor has said, that ankle arthritis, just putting that implant there is not going to make a difference. That implant has to be properly balanced so that it lives for 15-20 years. You can just put the best implant, and if you don't balance it, it will fail in a few days or months. So it doesn't matter who, it matters who puts it in. It doesn't matter how good or bad the implant is, but if you can put a average implant in a properly balanced place. And this implant that we have used is something that Professor has been using for so many years. It is his own baby. He has designed it. He knows the in and out of this implant. So, and these cases were so complex, let me tell you, because even if somebody who is doing an ankle replacement routinely, this was something that required an experience of Dr. Hinterman to. It was a very, very challenging case, because especially the second one. And but really, I mean, as a surgeon myself, I was extremely impressed. And the good thing is, Professor has his team, his wife, Dr. Roxa, who also comes with him, and they both work in tandem. So, and we saw to it that his comfort level at the hospital was good. We had all the equipment ready, and now the ankles are available in India, but they have to be specially ordered. They are not available, like you can't access it the next day. They have to be specifically ordered, but all that licensing process, everything is on. Right now the cost is a little high because it's a new implant. But as more and more cases are going to be done in India, we feel that, and India is such a huge country that if once people realize what is the benefit of this surgery, see, like, let me tell you, in the year 2000, I started doing knee replacements. Today it's 23 years. Today patients, don't ask me twice when to do it, because, there are so many patients around having a knee replacement done. So same thing will happen to ankle replacement, right? In another 4 or 5 years, people will accept it much more easier than, and we have the expertise, and Dr. Hinterman has promised to be supporting us academically to maintain a very high center of excellence in Goa, so that this can be used as a place to for all over India, people can come down. And Dr. Gurmeet Sangoi also is a ex GMC product, so he's done his orthopedics, but he's practicing in Mumbai now. So this is the story. So we wanted to all the people in Goa and surrounding states to know that total ankle is now possible in Goa, and it is not that we are now also having the support. Any complex case, designing, planning, everything with the implant, everything will be done in collaboration with Dr. Mr. Hinterman.
So when does one need ankle surgery replacement?
Yeah, he wants you to answer this. When does the patient require an ankle joint replacement? Doctor, you want to answer that?
Yeah, there are some situations that make a patient impossible to get normal life, quality life, such as pain or limitation for the movement. But nowadays we know that the minimum of activity that we need is to get a normal walk. And these patients are not able anymore to walk in a normal situation without pain. Living with pain is not living. So this is the main concept for us, to relieve the patients from the pain. And the other is the demanding activity that every patient can have. So some of them want more activity. We have to study the situation and give them the possibilities. Some of the patients are totally unable to do other activities because they are very old. So we give them also the possibility to improve their normal life.
And just to let you know, as an additional information, not think only about sports activities, because only the alternative is a fusion. And when you stand up from the chair now, you need motion in that ankle. So when you make it stiff or when you have pain, all these little activities you have in a daily life are a problem. So that's why, as has been said, is the pain relief and to preserve some motion.
After how many days, supposing if it's an athlete on whom you do the surgery, after how many days will he be able to get back on the track?
That's a question Professor will answer. She's saying that, what about athletes? Yeah.
These patients are impaired for so long functionally, and of course they need to go back to normal life. But when someone his expectation is to go back for playing soccer, it's not a candidate for an ankle. It's also not for a knee or for a hip. That is not our goal is to get them back normal activities, a social life, and of course, for instance, in Switzerland, people will go to ski, and ski in a ski boot. The ankle is well protected, so we can allow them. But in your country, maybe for walking, hiking, bicycling, those things are possible, but not contact sports.
Maybe it's important to just clarify something. There are two steps of injury, and we have to manage it and to understand that one step is when there is a normal athlete or a person that has any kind of injury, and we have to solve it. But when we talk about arthritis in the final stage, means that the complete joint, the complete ankle is gone. There is no more cartilage, there is no possibility to make this kind of activity. So we are focusing in these kind of patients, those that have no other possibility to solve a problem. It's the final age of an illness. It's a final age of the stage of the destroyed ankle. In that case, the possibility to have an ankle replacement, it's quality of life.
Is it possible that bacteria destroys the cartilage and eats it up? As in the case of TB, it destroys cartilage?
So, any infection can damage the cartilage. Any infection. Tuberculosis is just another one. You can have different types of bacteria. Tuberculosis is just another type. But in India, this is a very, very common problem that people get tuberculosis of the joints and they develop arthritis. Now, one of the problems is whenever you have an infection, we have to be very careful that this infection has been taken care of before we put in an implant. So any infection which has damaged the joint, we have to be sure, because if we put in an implant in an infected joint, it's over for the patient. Now, one of the things you have to realize is what was done prior to ankle replacement in these patients with arthritis. These patients were basically, the joint was welded together, what we call as fusion surgery. And these patients had a stiff ankle. Then the problem is that people feel that, okay, once the ankle is fused, the ankle will be painless. But what happens is once you move mobility from a very major joint, that mobility and stresses are transferred to the other foot, and the foot becomes painful. So it's not such easy thing that, people say that fusion works. Fusion works, but it works on that joint, but it causes a lot of collateral damage. Whereas when you do a total ankle replacement, it restores mobility. And that mobility is extremely important. Even that 5-10 degrees, as Professor said, which is required just to get up from a chair. Forget about walking and climbing and jumping. A simple act of just getting up, and even that 5 degrees is a huge thing for the patient whose ankle joint hasn't moved for the last 15-20 years. And as you said, it's not for athletes, it's not for active athletes whom you want to get back to. This is for a patient who has been suffering for 10-15 years from arthrosis.
Sir, is there any risk of body rejecting or major side effects after the...
Yes, any implant surgery, if you don't, infection is the cause. The body doesn't reject it. The reason why we sometimes remove the implant and throw it out is because once it is infected with a very strong bug, which doesn't control with antibiotics or by repeated cleaning of the joints, then we have to remove it. It applies to the ankle, it applies to the hips, to the knees. So the care has to be taken. That's why we have to do these surgeries in centers which are known to do other joint replacements, because all those protocols that are used for all other hip replacements, they have to be used in this also. So this is as challenging, or maybe sometimes more challenging, than doing a hip and a knee. But the expertise that Professor Hinterman has brought here with him and his years of experience is what makes it safe on the patients. Right? So myself and Dr. Rumin are, just learning the tips and tricks. It will take us a couple of years before, we can be certified as an expert, but there will be time Professor Hinterman will be there to guide us and help us along with Dr. Rossa.
What is the story of cartilage? Nowadays there's a lot of research and they say you can grow back cartilage again. Is it possible?
First of all, you have to understand that every joint is different. And the ankle joint has a cartilage that is more resistant than a cartilage on the hip and the knee. That is, and I cannot go into details, it's too complicated, but it's the recovery potential of the ankle is bigger. But the problem with the ankle joint is we have 28 bones in the foot, and we have to, the arthritis of the ankle occurs between a very small bone, we call that the talus, and the tibia. And this talus then become arthritic, starts to move or to go in a direction, and the mechanism is completely destroyed. So I not agree with Dr. Mahendra, because a hip is quite easy because you have a big bone above and below. All
no, I said the ankle is the most difficult.
Oh, you said? Okay.
Yes.
Then I agree. So I agree. But the foot, the knee as well, we have two big bones, one articulation. Even though the knee is a complex joint, it's much easier to replace. An ankle is much more complex because you can also not build a house of an unstable ground. The same is in the foot. When this little bone is not stable in a correct position, it doesn't work. And that's also, when you ask about the cartilage, when that becomes unstable as a long evolution, the cartilage is worn out step by step. And if there's a certain decrease of damage, it's done. And to think about in such a situation to put the cartilage repair process, it's not working because the normal mechanics is gone. That's like you have a car, the tire is gone, or the wheel is not correctly working, then the tire goes away, and you can put a new tire. You have to first to fix the wheel, and that's I think that's most important.
So the point he's made is that you can put the best cartilage on wherever it is, but if it is not a stable surface, that cartilage is just going to peel off and fall off, right? So it does work in certain stable joints. It may work if you're in the knee, or maybe it will work in the hip. But in the ankle, the forces, the point loading forces are so high because it has just one motion. The ankle cannot compensate like a knee. It doesn't have a rotational movement. A hip has a 360-degree movement. The ankle is just in that movement. So if any malalignment is a huge transfer of forces to one area, and if you keep putting new cartilage there, it's just going to fall off till you don't rebalance the forces on that cartilage.
I'm not talking about replacing cartilage. Now, they say that there are certain medicines, drugs, which regrow that cartilage.
Yeah, but regrow on what? On the unstable surface. So if you don't repair that stability, no matter what cartilage you grow there.
Like they say the knees, you can take certain medicines.
So mechanical stability is important before you put in the regenerative cartilage on any surface.
Doctor, can common men afford this surgery?
Well, so right now, the biggest obstacle for this surgery is the cost. And it happens because when knee replacement started 20-30 years back, cost was an important thing. But now with Deen Dayal scheme, government gives almost 1,40,000 for a knee replacement. So patients can almost use that. Similar thing we are trying to establish with the government, whether we can have ankle replacement. So we will take time for patients to prove to the government, because that's a process that takes time. But at this point of time, yes, it is a very expensive surgery because of the things involved in the licensing, the amount of the cost. So that will eventually come down. But as a technology, it has been proven for the last so many years.
What is the amount?
Right now, the cost of the implant is around 5 lakhs. Just the cost of the implant.
Major insurance plans been covered.
Insurance definitely covers that cost. Insurance covers it. If you have a private insurance, it covers. But but Deen Dayal is only 140.
Yes. Thank you.
When we talk about this type of surgery now, so people don't know about this type of surgery. So more awareness do you want to more awareness to do about this replacement surgery?
Yes, we need to talk to patients. We need to talk to people. We need to have talks on arthritis, and that's what we are always trying to educate patients, because the fear of surgery itself in India is a big thing. The moment you tell the patient surgery, it goes on the back foot. But what you have to understand is the surgery is not a last resort. A surgery that is done on time will give you the best outcomes. If you wait for so many years and say that when everything is destroyed, that makes the surgery more complex. and then outcomes long terms are not good. So if you don't do it on time, yes, you are always going to get a good result.
Yes, thank you, sir.
Thank you.
This is basically a senior citizens problem, is it?
Senior?
Senior citizens.
problem? No.
In the older population, it is 60 plus.
No,
No, the opposite.
no,
It's the
no,
opposite.
no.
Arthrosis and all that?
It's opposite.
Arthritis and all
Ankle
that.
is opposite. Ankle is little. Both these patients, by the way, are in their 40s.
The injuries happen early.
The time is changing, and
Patient
we
is
see
45.
that more and more
Yeah,
young
40,
people
45.
are involved in very special activities and
It's a bone
sports.
patients, is it?
No,
Yeah, one is a
the,
bone.
the problem is osteoarthritis of the ankle joint is about 70 to 80% after a trauma. And the trauma happens based in younger patients. So when you look at statistics all around the world, you know that the patient coming with an end-stage arthritis to see the surgeon is about 10 years younger than a hip or a knee. A hip and knee patients, that is an illness that the cartilage is gone because several problems might be as congenitals, but in a knee, in the ankle, there are younger patients. That makes it so difficult because when you fuse an ankle in a young patient, he has a long life expectation afterwards, and he will come back with other problems. So it's very important to state that even the insurance companies, they have realized now that a patient who gets an ankle fused very early in his life, with all the treatments that come afterwards for treating secondary problems of the foot, it's much more demanding also financially. So that's why we have a trend in many counties now that we turn over to the ankle replacement surgery.
For general public who doesn't know, ankle fusion is another alternative to ankle replacement where we fuse the two bones so there is no movement. So till ankle replacement was not available in India,